So I just finished my skeletal expansion last week. I had the Marpe taken out, and guys, first thing I can tell you is my mouth is way wider than before. My whole tongue fits on the palate of my mouth, which is crazy because before I started, I would have my teeth leave scallops on my tongue. That means there was imprints of my tongue pressing against the teeth. And now I could fit the whole tongue pressed against the palate, and they're barely like a millimeter away from touching both sides of my teeth, so that is huge. Second thing I noticed was that my breathing, my nose breathing is way better. Even my voice changed when I hear myself talk compared to my previous videos from over a year ago. I used to have this very nasally voice, like something like that. And now my voice sounds much more clear. I can articulate better. There's one con that I'm addressing right now with this thing called a TAD. Had it put 2 days ago. I might even do jaw surgery still. But the negative thing about skeletal expansion, and I tried to avoid this as much as possible, maybe not as much as possible, but I brought up questions about it and it still happened, and that's asymmetry. I think my face became more asymmetrical. I know on the mouth area it did, but maybe even my eyes. Like before, my eyes were perfect, same level. And now I think that this side of my maxilla, it expanded downwards and forwards, I believe. It feels like this tooth is much more forward than this canine. This canine is more forward than this canine. It's more down, while this side went up and a little bit back. That's possible, but that's how it feels like. And in my CBCT scan, it looks like my jaw kind of shifted in one direction, but I have to check with the surgeon. But the negative was that this side is more gummy, as you can see. See that? This is how I want it to be. I like this tooth show. This is too low. Like when I talk, you can see my teeth, which is fine. That's actually pretty good. This side you can't see, which makes you look old. But when I smile, and I used to be a big smiler, but for this last year, I've been forced not to smile because I think it just looks whack. It doesn't look pleasant when I smile, and this side's like two-face, gummy and normal, or a little high. So yeah, I just had a TAD put in here, one here next to one of my molars. And what's gonna happen tomorrow when I might start this treatment is a power chain. So it's gonna intrude these teeth upwards into the bone. And I'm gonna ask as many questions as possible about this because I don't want to have any more damage done to my body. Like every time a TAD is put into your bone, guys, I think it touches a nerve or something, and you lose sensation. You lose feeling in that area for some time, maybe forever. And this tooth sensitivity on this tooth right here, it doesn't feel the same anymore. It might be temporary or it might be permanent, but it's like this tooth died in terms of feeling. This one's way more sensitive in a good way than this one. This one feels like it's just in how do I say it? Like in limbo. Like you feel it, you feel that it's there, but you don't feel anything, if that makes sense. It's like you lost the feeling that you had before. You lost sensation. But overall, I would say this was a good investment because I used to breathe way differently. I had the worst night's sleep. I still kind of do. I use the CPAP, but it's not as mandatory like it was before. If I have no allergies, the expansion from the Marpe is sufficient enough to give me a pretty good night's sleep, relatively speaking to the past. But now with my breathing, like I could take a deep breath through my nose, no longer through my mouth. Pretty easy. And what else? My biting, it's way better. I don't bite my cheeks anymore. Something about having a small jaw, you tend to use your muscles your mouth muscles way differently, especially your buccinators. You tend to compensate with your buccinators to chew that food onto your teeth when you have a small jaw. But when you have a wide jaw, all that food can rest inside your palate, like from your palate and your tongue. It can get smushed in there because you have all that room, and anything else goes to your teeth. Before, since I didn't have any much room, all the food would be stored like a chipmunk, right? Extra food would be on the cheeks. So even though I'm kind of lean, right, I still have these cheeks. It makes me look fat. And that is no good because it's not natural to look like this. So, what's next? What would you do if you were in my position where you have sleep apnea and you know it's a skeletal issue because whenever you look in the mirror, something just feels off? Well, I would say go to a Marpe provider, but in hindsight, what I would do is go to an orthodontic surgeon first. Somebody who does double jaw surgery, and tell them, hey, I want to do this because, first of all, my breathing is bad. And they'll ask you if you have sleep apnea. So do a sleep study. Do it like by Lofta. It's pretty good. It's the best at-home sleep study you can buy. And they'll even sell you a CPAP if you need it, if you want it to. But let's say you go to the surgeon and they tell you, yeah, you're a candidate. Well, take advantage of your parents' insurance if you're still under them, or buy the insurance policy that will that you're desired, buy the insurance policy that your chosen surgeon takes, so you don't have to pay hundreds of thousands of dollars to improve your life. Because right now, guys, this Wednesday I'm going to go see a surgeon, my third surgeon, to see if I need double jaw surgery. And you know, through this whole journey, I've been right on most things. I knew the expansion is something I needed. I knew the frenectomy for the tongue tie is something I needed. I knew the expansion could be asymmetrical and it would be negative, and it has been in that aspect. But there's still, I feel like I'm almost there where I need to be. And I mean, I don't look recessed, but I definitely feel like this jaw is not projected enough, especially with the mid-face too. Like, maybe because I'm fatter than I've always been. I'm not fat, but like, I'm heavier than what I'm accustomed to. But I know that these jaws can be projected more, because if I had a narrow jaw, a small narrow jaw in one dimension, the transverse dimension widthwise, what is the probability I'm also deficient in projection? Very likely, especially given my family genetics and what my dad looks like, what uncles look like, what my sister looks like, sibling. And I know I screwed up my development with what I ate and what I didn't do actively because I didn't have the knowledge. So given all that, I know for a fact that I stunted some growth that I needed. And most importantly, I had a retainer on these teeth, guys. If you have a retainer during development, you're basically having a wall. You have resistance that doesn't allow your jaw to grow any forward or wider. That retainer screwed me up so bad, and that decision to not take it off when I was 10, because I had those braces very young and had a retainer put in so young. Who would have thought? That decision eventually led me to discover airway 15 years later, or 13 years later. Now I'm at 15 years later. And doing this operation, spending thousands of my money to improve my health, right? But whatever, money is for us. So if I'm going to spend money on something, it's going to be something to improve me, right? So the next step is jaw surgery. I know this video was for Marpe only, and I'll make one specifically right after this, just Marpe and what my thoughts are, but I wanted to include everything where I'm at, because I started this journey last year, or maybe 2023. I think it was 2023. No, 2024, guys. Right when my sister left for the Navy. when I got really fat. I was doing this training protocol, training once a week, doing some eccentric style of training, which it had its benefits, but that's when I really got fat and learned that I had a problem that if I didn't address it now, maybe down the line when I'm 40, 30, it would get way worse when it would lead me to put on way more weight. But I discovered that when I was like around 168, 170s, like when I would weigh around that much because I was bulking, getting big, my neck and my face accumulated so much weight, it would start to narrow or collapse on my airway through my neck. That's what I think caused the symptoms. Because when I'm lighter, I don't really experience it. But when I got that heavy, guys, my breathing and my sleep was so trash. And I didn't realize how fat I was at that time. I wasn't like obese, but like, you could tell. You could tell I put on weight for sure. I still had like visible abs in a way, but like, I was definitely more fluffed. And that led me to discover tongue posture, mewing, all that stuff that's, it's been outdated now. And then led me to a tongue tie, the importance of the tongue. The tongue develops your face posture, which led me to discover I had a posterior tongue tie, just a mild one. And I think that also contributed to me biting my cheeks. Doesn't happen anymore, so look at that. Unlimited range of motion. Before my frenectomy, I could only do this. Couldn't touch the top of my teeth, guys. Way better mobility, thank God. So, did that, and then that's when that doctor, Risa, my myofunctional therapist suggested Dr. Risa, who then led me to meet Dr. Zaghi, an airway guy from Los Angeles, doctor, highly ranked in the airway. I'm not sure what type of doctor he is, pediatrician or airway, something like that. And that's when I was recommended a jaw expander. And I had already known about this idea from me studying it on Reddit and on YouTube, listening to jaw hacks at this point. And I was like, a doctor says I could benefit from 8 millimeters expansion. And that's when I went to go see the orthodontist that I've done treatment with. And that's where I really started last year in July. Like a year ago, like during this week, that's when I got the expander put on officially. I started my plan in May, that's when I agreed to terms, or June. And boom, that's when it all officially kicked into hardcore mode, because it was no longer any soft tissue improvement. Now it was skeletal. And man, the pain, patience, changing of identity. Like I would look in the mirror every day once I started turning, and little by little my identity, how I saw myself, changed. Like if I saw my old face in pictures now, I don't really identify with that person. Even if I go back and look at old pictures of me, like it's like it's a different life now, just because of how I feel with so much more oxygen. How I look, I think I look way better. Even with this asymmetry, just having a wider face, for me was crucial, because I used to look like, this is the problem, guys. When you have a small jaw or a small face, it's not good at all in terms of like leveling up. There's a certain point where that look makes you look juvenile as an adult, and it could not attract the things that you want, like a partner or anything like that. So with the wider face, I just feel way more confident. But that's a result of how I feel in my brain and my body, because I just feel way less anxious. Because when you breathe more oxygen and breathing is way better, you feel much, much better overall. So now we're at the point where I'm officially done with the Marpe. Look at that. Huge, guys. That is huge. I'm so proud I did this. 1 year. I usually take expanders out after 6 months, and I kind of snuck in a quarter turn after they told me to stop just to make sure I got to the desired goal of 8 millimeters, I might have not reached it, but it's more than sufficient for my tongue. So I'm satisfied with that. But I had the expander on for a year, which is unheard of. The ortho left it because maybe he was focused on other stuff, or just wasn't a priority in the second phase of the Marpe, because the first 4 or 5 months, turning and the braces after the turning and locking, like, he was very involved with my case. But after that, and the braces were put on, it kind of like just went passive, like just chill. And I wasn't as active on asking questions. So the last 6 or so months, or 7 months, on 8 months really, it's been kind of limbo with the Marpe and just getting and the jaw surgery. Like, I really put this on the back burner for the last 8 or 9 months, because last year I was really going after it and I got things done quick. Braces, frenectomy, skeletal expansion, and I put a halt to it because I thought maybe I don't need jaw surgery. Maybe I could benefit from it, but is it really necessary? I'm gonna do the expansion first. And ironically, I'm still in the same place in a way. I've improved, but there's still room for improvement because I still have to use the CPAP. That's how I feel. I still need to use the CPAP to feel 100% in the morning. And even with the CPAP, it doesn't feel 100% because that thing slips off at night, or isn't fitted right. You turn and then it's not on your nose correctly. Well, then you're cooked. Then you don't have the best sleep, and the cycle starts all over again with some trash ass sleep, and you feel like garbage. But anyways, now I'm at the point where I'm doing my 3rd consultation, and honestly, I don't really want to go, but I gotta go because it's gonna be on my mind. What if I could benefit from jaw surgery? If I find a surgeon that believes in my case, believes in me, and could see me benefit from it, because that's the most important part. Because you could feel however you want. You could be like, I want it. And if an experienced surgeon tells you you don't need it, I won't operate on you. That's what my 2nd consultation happened. Then you feel kind of crazy. You feel invalidated. But at the same time, it felt good when a surgeon told me you don't need it. It's not something for you. You're fine. Self-esteem wise, that felt good because you don't feel like an ugly, recessed, deformed human being. But at the same time, you don't find the conclusion that you want for your questions about why do I still feel this way? Why do I have sleep problems? Why did this test tell me I have obstructive sleep apnea, which I did get on my at-home sleep study? The only reason this jaw surgery lingo is still in my mind is because first, the asymmetry. If these TADs don't give me the result I want, right? Which I think they will, because look, this gum show isn't too bad on this camera. This gum show is ideal to me. It's similar to my pre-orthodontic treatment gum show. My pre-orthodontic treatment gum show was amazing. I liked how my last ortho did the gum show, like the tooth show, I really liked that. But now with the expansion, it made my asymmetries more pronounced because I have more volume, more area to show. And this side of my jaw just grew a little lower than this side. Maybe it was always like that. But it's gonna get addressed so it can level out and I'll look symmetrical. Now, this is the thing, guys. My skeleton is mid in terms of the face. Projection wise, it's probably bad, honestly, for projection, or okay. Width wise, it's pretty good. I would say I'm above average or just as good as anyone now after the expansion. That's why I feel like if I do this jaw surgery, it'll put me at the elite tier of like health and airway. It's gonna take me to a level where most people don't ever get. Like right now, I feel like I'm a step behind everybody in terms of that, but if I just do the surgery, not only will I be normal, I will even exceed them. and then your life transforms in many ways. So there's so many thoughts, man. So many thoughts about this whole process. I've not talked to anyone about this, so that's why I'm making this video. Like, there's nobody in my life I can really talk to that could relate to something like this. Going through this whole process, being patient with it, dealing with like your face changing, asymmetry. You don't look as good as before, subconsciously, and not being able to like bite on a hard ass piece of food because I have braces, and your teeth are sensitive, they're moving, all of that. And now I got more metal in my butt. I had tats for a freaking year, guys, and the day I got them, coincidentally, I had new ones placed for the asymmetry. Like, you're free and then you're back in, you're locked back in. And what's crazy is I think the day I get my tats out is probably when I'll get jaw surgery. The only thing that concerns me about the jaw surgery is the sensation of losing the sense of touch, of feeling. I didn't think it was bad, but when you feel like you lost touch in one part of your body, it's like part of you died, like part of your soul left. Because when you don't feel the same, it's like you're slowly dying and you're no longer a part of this reality. You're not perceiving the same. It's kind of sad. So that's the biggest risk, which will likely happen maybe, which I don't want to, but if you get jaw surgery, that's really the biggest risk. And honestly, I think if somebody or jaw surgery was made 100% sensation proof, like you will retain 100% of the feeling like you did before, after the jaw surgery, I think so many people would do it. Because when you lose sensation on your face, you might lose mobility, you might lose muscle memory, you just might not operate the same as a human being because you just don't feel like how you used to feel. You might not be able to feel stuff that would give you the emotions you once projected, and then people see your vibe is different. Like, it leads to so many things. That's why feeling is so important. If we have feeling on our face, our whole body. If it wasn't important, we wouldn't have it. So that's the thing about losing sensation. Like, just me losing sensation on my canine, subconsciously I felt sad about it. And it just might be the pressure, but I hope my sensation on the canine goes back to normal after the tats are taken out. And I hope no more damage is done once I have the teeth intruded. Like here, like this gum show right now, I actually kind of like it when I just see the right side. But when I see it compared to the left side and I smile, and especially in pictures, like in this camera, because I'm so used to seeing my face, it's not bad. But when I look at a picture and I just see like how my smile's like not even, not symmetrical, it just throws off the whole aesthetic. And it just looks weird, and I can't really express how I used to express. Like here it's not bad, but once I replay this video, or if you're watching this, you will notice the giant asymmetry, and you're like, that doesn't look good. Of course it doesn't. However, it's just part of the process. So, man. So those are my thoughts on everything. I'm gonna make another video because this is gonna go on for a bit. So next I'll just do the Marpe video. And yeah, guys, jaw surgery, skeletal expansion, it's been one hell of a journey. And if you're at this point in the video, I would just advise you, if you're thinking about doing it, just do it, guys, because I was 23 when I started this process, and I'm already 25 now. Like almost 2 months past, almost